You know, early in my career, I used to sit there and just all day, and it was exhausting. I don't like doing that anymore. I like to save my energy because, well, I don't really have to work that hard anymore. So, I mean, I guess that's why you caught me napping on the job. I just like to lean on people, in all honesty. I mean, as long as you guys know your anatomy and physiology, there's no reason why you can't just lean on people. You just got to know where to lean. So, it may look like I'm taking a break on the job, but our client's actually really enjoying this. She has no idea that I'm barely paying attention. That's not true. I'm paying attention. Paying attention how much pressure I'm using and the points that I'm pushing on, but I'm nice and relaxed. So, let's take a look at what I'm actually doing here. Right over here. Not the actual elbow. Right here. I'm sliding that just inferior to the iliac crest, and I'm applying a little bit of pressure. So not only are we pressing into those tendons, into the musculature, we're also doing a distraction. My client, for the purposes of this video only, has lower back pain. So that's what we're treating. Nice little distraction, a little bit of work to those glutes, and because I got this arm free, I'm just sinking it into her thoracic spine. Again, nice and soft, not driving an elbow. That's not going to be relaxing for her. And after a couple minutes, we can move around. One of my favorite techniques to use is rocking. I love to rock people. I'll rock people for 10 minutes straight, and that's not an exaggeration. I'm being dead serious because it feels great. I mean, just look at it. I'll sit here and rock, 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 get that lower back moving. Then I'll move over to the iliac crest, just rock here. I only need one hand for this, even better. Keep going down, all the way down the leg. And we got muscles in the lumbar spine that attach to the rib cage, right? 12th rib, QL, lumbar spine erector. So let's get the rib cage involved. And you can even grab the iliac crest and start rocking towards the feet. And there you have it, just doing a little bit of rocking. The whole lumbar spine is loosened up now, nice and relaxed, and we've barely done much of anything. Now, we can't just do that in an entire treatment. I mean, we could. I do it for a good 20 minutes. But there's other techniques that I like to use when I'm feeling lazy. Distractions work really well. Anybody who's had lower back pain before and has had it distracted, it is the best feeling in the world. You remove all the pressure off of the joints, stretch out the muscle, stretch out the connective tissue. It feels fantastic. And since everybody nowadays has hyperkyphosis sitting at computers, we can go into the thoracic spine and just press. Press. Grade 1, grade 2, use whatever grade you like. How I actually do it in practice, normally I'm oscillating. I find this relaxing. Just shift my weight a little bit forward and back. Let their body do most of the work. If you guys are super lazy, like I am sometimes, you don't even have to oscillate. You can just sit here, compress. I like to put a little bit of resistance so that as they inhale, I resist that just a little bit. It's going to help strengthen the lungs. It's also going to mobilize the intercostals. Now, for all you guys out there who say, you know, my clients, they like deep, deep pressure. I can't get away with this kind of stuff. Anytime you hear someone say they like deep pressure, instead I want you to hear, I want more specific pressure. When people want deeper pressure, they really want you to be a little bit more specific. If you push specifically on a on a problem area, it's going to be pretty uncomfortable. If you push pretty deep in an area that's not problematic, they're going to want deeper pressure. So I'm going to teach you guys how to get around that. If I want to work on the thoracic spine, right beside the spinous process, there's a little groove in there. I like to put my elbow in there and just sink. Now, when I say sink, guys, be very, very careful. This is sensitive stuff, okay? So I'm putting very minimal pressure there. But for our client, it feels pretty moderate. And if I go even just a little bit more, it'll be probably too much for her to handle. I can sit there. I can do the lumbar spine at the same time. And again, I can just sit here and camp out, chill out. Work's being done for me. I don't have to do too much. Okay. Now I can sit here for a minute, 2 minutes, 3 minutes. It'll feel great for the client. But we can actually just start to walk and move up to one segment here and move up one segment here. And in this way, we can treat the entire back like this. If I kept doing this for 30 seconds to a minute each point, that's about another 10, 15 minutes of the treatment gone. And all for the benefit of the client. How are we doing, client? She's doing good. That's it, guys. There you have it. Lazy massage. You don't have to work so hard. Take it easy. Pay attention to what you're doing. Put a little bit more focus into the points. Just sit there, hold them, and you'll get fantastic results. I could promise you that.